Welcome to the Childcare Revolution Podcast, where we talk about all things childcare.
I'm Tegan.
Hi, I'm Stephanie.
And I'm Patricia. We acknowledge the land we are meeting on is a traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Hi, everybody!
Welcome
to the Childcare
Revolution
Podcast!
Oh, God.
This is the episode that you get to see our faces.
Isn't it lovely? Wow. You can
Stephanie looks so tanned and, summery. And Tegan just did some amazing off-camera skincare. And I just look like someone who was very angry the whole day. Welcome. That's how I look on a daily basis. You did. You missed us showing off our tans.
Prior to.
So this episode is going to be a little different. Not that we were scripted before, but we always had kind of an outline. And when we met this week to talk about what we were going to talk about, we realized that we are very tired. We're exhausted and drained. And that is very normal for early child educators. We feel like that all the time. But this is a very different kind of tired.
Very. And we feel like a lot of other people are too. So this is kind of what brought this up.
Especially when you get involved in advocacy, that because you're trying to achieve something and you're trying to make your voice heard. And in this case, it feels like it's not. We're going.
Wall.
Yeah, we're hitting a very hard conservative wall that doesn't care about children or women. It's great.
I don't even know if it's a wall. I feel like they're bulldozing us. I feel like they're just
we were going to talk a little bit about pandemic fatigue. We are going to obviously touch on educator fatigue because we are educators and we suffer from that. And maybe we could give a few updates on what's going on with us and how we are getting ready to go back to an outside of our homes lifestyle. Does that make sense? Yeah? Okay. You two seem very aware that you're being recorded, your faces, you're And listeners, if you're listening to me, if you know me in real life, you know that I don't know how to do that. That's how I almost flunked out of my telejournalism class in university a few years ago. Because people would be telling me one of the things that I reported on was my university campus had all these stray cats, and that there were people that were trying to neuter and spay the cats and feed them and vaccinate them so that we could have population control. And there was this one person that was like, yeah, I put poison in the food that I gave to them. And I couldn't hide my anger. So I'm holding the microphone and the person says that, and I'm like, I need to be excused. Yeah, it was not the career for me. Lucky for the children and families of Ontario. Yay! Okay.
Wow, that's a story.
It's not a childcare story, but it's a Patricia story. Do you two want to give an update to our listeners and / viewers? What's going on with your lives? Are you going back to childcare? Yeah.
Well, I'm not actually working in childcare. I was a supply before all this, but now I guess I wouldn't have a chance to really go back in childcare settings anymore because obviously my centers will have reduced number of staff and reduced number of children. I feel like the most likely thing that I would be doing will be in-home childcare, which
Like
is not
providing
actually,
private care.
yeah. I did get like an offer from a parent that I was working for, but that's about it. And then I have my school now that will be online for the fall term, which
Um,
I don't know.
Tell our listeners what you are doing this summer because it's very important.
Well, I am interning at the Childcare Resource and Research Unit, where I've learned a lot about policies, health and safety guidelines, and where I've realized that we really, really need a national childcare system because going through all of like those different guidelines was such a hassle. And this Tuesday, you both were not on the call, on the EYP call.
Yes, I was.
Were you?
I was.
I was.
Oh, how did I not know?
You weren't on camera.
I did not have a mic. Okay,
Yes, you
so
did not.
remember that child care provider, they told us how they had to go through all the guidelines themselves to create a policy for their center. And that shouldn't happen, right?
Yeah, and I think that's what's happening with any childcare center that's opening right now. They're creating their own stuff based off what the government gave us. That in some level in regular life pre-pandemic, that's true because every childcare center has their own parent handbook, their own policies and procedures, but they're based off documents that are like a starting point for everybody that came from AQI or licensing or public health, etc., etc., etc. But with this, it's so new and there's so much detail to it, and the government document has what, 17 pages, 20 pages?
Yeah, something like that.
What we heard from, so yeah, EYP, when we talk about it, it's how we met, the three of us. It's the early years professionals community of practice, and it's Toronto based, and in it there are several educators, supervisors, directors, professors, students, people who are interested in advocacy. And in our last meeting, we had a couple of providers talking about what they're doing for their reopening. And it's pretty upsetting. It's pretty heartbreaking to see supervisors that are worried about their centers, that are worried about their educators and their children and their families. And all of this weight is on their backs, right?
Well, just think of like the stress to begin with of like you having to deal with this on your own home, and then you have to like make sure you're dealing it with like a ton of people, right? It's immense.
A lot of people like my mom or my friends back in Brazil or people that I just know ask me if I want to become a supervisor or a director one day. And the answer is no. I am very appreciative of those who choose to go that way, but I do not have enough self-regulation skills to handle that job. I know I wouldn't, because I get frustrated, and when I get frustrated and angry, I cry. And it's not professional to cry when talking when talking to, I don't know, Ministry of Education or licensing or AQI or whatever. So it's just not for me. Anyways, immigration is never going to let me do that anyway. So moving on. How was your internship, Tegan? Do you love it?
I love it. It's hectic, but I love it. I've been working with amazing individuals that that have done a lot of research and advocacy work, and my supervisor is actually one of the member of our community of practice.
Mm-hmm.
So
You're not going to be able to go into their office, right?
nope, they're going back to the office, but I cannot. I'm not allowed. Which
As a student, right?
sucks, but I know that my college wants me to be safe. So yeah, it sucks.
Maybe you can have an after work hang, like a picnic at the park or something.
You
That
were
way.
saying, though, you could maybe do an outdoor meeting.
Oh, that's what we hope for.
Yeah.
Yeah.
What about you, Stephanie? What is in the cards for you right now?
I've been selling shoes. I'm back at my part-time job at the moment. So I sell shoes. I'm back in retail as a get out of the house transition period, which is nice. Word of my center opening, nothing as of yet. They were aiming for the 6th, but the 6th is in 4 days. So, oh yeah, we're also recording on July 2nd. So in 4 days it was supposed to open, but I don't know if it will. And yeah, I've just been tired. It felt like there was like a lot of energy after the rally and things like that. And us doing the podcast, me getting really pissed off and going to chalk the neighborhood. I was really angry that day. And then it kind of felt weird to have this come down where it was like all of a sudden everything went kind of quiet.
Yeah.
Yeah, it was just like a weird.
It's a
like,
weird limbo.
Yeah, it's like you still have like the energy to do something, but you don't know exactly where to start because I'm the type of person that I kind of need a guideline to go off of in order to do stuff sometimes. So when it's like that, I'm just like, what should I do? Should I keep going the same direction? Should I kind of like do something different? Should I just be quiet for a little bit? Like, it's a weird situation.
It's also because we are focusing on our energies on, like, for example, you've told us that at your part-time job, a lot of people quit. So you're having a lot more hours. So there's only so much energy and so much time in a day.
Yeah.
Right? So there's that. And the same thing, like Tegan is focused on her internship. I'm getting ready to go back to work. Like all of these things are happening. I'm trying really hard to work on not driving myself insane and not asking so much of myself that at the end of the day I'm exhausted. And that happened a lot throughout this pandemic, that I would be sitting in front of this computer on Zoom meetings, writing stuff, posting things on social media, making videos for 12 hours a day. And that's not healthy.
No. I feel like we all miss spending our energy with the kids.
For sure.
Working with adults with the screen for like.
I don't like it.
So much.
That's why I quit my other career, girl. I don't like screens and I don't like adults.
Oh my God, same.
But Stephanie,
like, yes,
you have very awesome upcoming news for September. You're starting something new that is very cool. I think you should share that with our listeners. I don't think we have shared that.
I don't think I've shared it yet. Yeah, I'm starting my master's in early childhood studies.
Yay!
It's all online in the fall, like Tegan. Yay!
We can do it.
I have my Q&A coming up soon, which is really interesting. Yeah, I just have to let my work know.
Do you know what your focus of your research is going to be already? Do you have any idea?
It could change so easily, but like, you know me, I love environments, so I'm definitely leaning towards that because that's what I think is crucial, and I don't know if there's necessarily enough information on it. There's like information on like the environments for children, but not necessarily the environments as a whole for
Mhm.
staff and how the staff environments reflect in the children environments and how they just intersect with one another.
I love that.
That's what I'm kind of leaning towards. So it's more of like policy, I guess.
Yeah.
on that
Is it
side.
a 1-year program, or are you going to do it in 2 years?
It's a 1 year. It's a 1 year, 3 terms. So I go fall, winter, summer, which is nice. I've gotten half of it on a scholarship already, which is awesome. I'm just waiting to hear about the other part of it, which is 5,000 is already amazing. So just waiting to see if anything else comes, which would be really awesome too, because like obviously I don't make that much money.
Yeah.
So that would be cool. But I'm excited. I need to like start refreshing even more. And the advocacy part of this has helped a lot. Just being able to talk to you guys, being able to talk to the wider group, hearing everybody else who's been in the master's program. It's like, it's a lot
It's
of information,
reassuring.
but I'm really excited. Yeah.
Yeah.
Very excited.
Well, that sounds like a very exciting September for the two of you because you're all going back to school. I really want to go back to school, but we need to wait for immigration. So it's good because it gives me time to change my mind 700 times because I've already planned to quit the field. I've already planned to quit the province. I've already planned to quit the country. I've already planned all the things, and then I keep coming back to, I can't quit this. It's my thing.
That's the worst part about it.
But I am going back to work with children in the very near future. So different from the two of you. On Monday, so today is the 2nd, the Thursday. On Monday, the 6th, I'm going back to work with my coworkers, and we're going to be setting up our room, cleaning up, and yada, 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 all of that. We were told we're working all week, so I'm curious to see what that's going to look like. I wonder if we're going to have staff meetings, like a social distance staff meeting. It would have to be in the gym because there's so many of us. But that should be interesting. I can't wait to be back.
How are you feeling?
I've been back and forth. I think that I don't know that if I was a world leader or if I was a premier or mayor or whatever, if I would have made better choices because I also don't have the kind of information. It's impossible to know. But I get this feeling that these 4 months of closure have been kind of wasted because of the way they were reopening things. Because we're saying like, oh, okay, keep to your social bubble. You still wear a mask, all of those things. And when I go outside, I don't see anything like that happening. And
like, for instance, at my work, I wear a mask, but I'm still dealing with like hundreds of people a day.
Yeah.
So like, there's no way I could have a bubble of 10 when I'm like constantly interacting.
Yeah. And then I just like, I see people at restaurants, and like yesterday we took a walk around the beaches, just south of where I live. And we didn't go to the beach itself, but just like Queen Street and Kingston Road and all of that. And there were people at the patios. And I know patios are open, but it's just like, in my mind, I don't think I'm going to go to a restaurant for another 6 months or a year. And
have you guys seen clubs open?
Yeah. No, when I was looking up the thing about the masks just before we started recording, it showed up one of the things of like, Toronto club, we've set 125 people last night. Like, who feels like going to a club right now? No.
Yeah, no. I don't even like going to Toronto clubs to begin with.
I'm too old
let
for
alone
clubs.
Like
too old for clubs. I was too old when I was 18. I'm too old at 29. But the other thing is, also, listeners, since we recorded, our own Stephanie Walker is a year older.
Oh, yeah.
Yeah.
I'm 24. No kidding.
Yeah, I don't feel scared. Like if I catch the virus, we deal with that. I have a huge problem. It's a pattern in my life of worrying too much about stuff before stuff actually happens. So I'm not thinking about that. I'm taking care of myself. I'm staying healthy. I'm washing my hands. I'm wearing a mask. And I'm staying distant from the people that could, pass it to me.
Yeah.
I feel like eventually we were going to have to reopen. Waiting for a vaccine would be lovely, but unless money stops being a thing and things just start being free, that's not a possibility.
There
So,
was like a lot of places that handled it differently than we did, and they did keep things open.
mhm.
And they kind of worked around it that way and kind of implemented things to keep things open. But we kind of like,
Are you
we
talking
shut
about
down.
places like Sweden and stuff?
Yeah.
Or you
Well,
Like even,
but when we think about Sweden, Sweden has a very healthy population.
yeah.
It backfired a little bit because they had a lot more deaths and cases than they should for the amount of population they have. And they have completely publicly funded childcare and healthcare.
Yeah.
So it's easy
Which
to
is a
keep
big
things
difference.
open.
Yeah. But I just mean in the sense of like, it kind of went like, okay, we kind of were really slow to shut everything down. And then we
Yeah.
kind of kept it in like a state of like unknowingness. And then all of a sudden it's like rushed to open everything.
Yeah.
Like, that's what I mean. Like, it was like we handled it a little differently.
Well, I obviously my perspective is always going to be of an immigrant and of a
Yeah.
Brazilian person. And Brazil is going to be a huge dumpster fire for many years to come because of the current state of things, and the pandemic just made that worse. And in talking to my mom about it, and my mom and I have very different world and political views, but she was saying something that I agree with, was that the pandemic became a political issue. It became
Yeah.
almost like a partisan issue.
Mhm.
But it's also very easy for anybody from a party that is not in office to say, this government is screwing this up. They should have been doing this, this, and this. Because when you get to office, it's very different, right?
Yeah.
As people, as voters, we get to say that. It's all right. It's part of democracy, of like, you need to do a better job. And I do believe our government, all three levels of it, could have done a better job. But it's not going to serve us anything to be thinking about the past. Not right now,
Yeah.
not regarding to this. Because we're going to reopen anyways, right? And
Exactly.
I'm in this position that I do not have any children, so I don't have to worry about childcare. I don't care for, not that I don't care about them, but I don't take care of them, of any elderly relatives or anything. My parents live back in Brazil. My partner's parents live in Vaughan, and we don't see them much. Um, so I have this position that I can just go back to work, and if I get sick, it's going to be me and my partner. We're both young and healthy.
Yeah.
Um, I forgot where I was going with this, but so to answer your question, I'm feeling
Yeah.
about it. I'm excited. I am hopeful that we won't have to close because of an outbreak. Um, and I'm a little scared, but not of the virus itself, but of how people are acting. Like, are people going to be super paranoid? Are people going to be telling their children not to come near their teachers? Like, I don't think that my parents in my care will, because I know them, but I don't know.
So, okay, a little bit perspective, because like I've kind of been the one out of the three of us kind of in a public setting at the
Yeah,
moment.
yeah.
Um, a lot of people are not paranoid. Some people are really happy about the protocol set in place, which is good. They just like that sense of security, which is really good, and the security of it itself. I deal with kids even through this. They let
Yeah.
me measure their feet. I can obviously not get close to them, but like I can talk to them. I can make jokes with them. And the parents are fine with it. They haven't gotten any complaints about that. So the parents have been pretty relaxed out of the ones I've seen so far, and I've seen quite a few.
That's
So
great.
I think that's something that's relieving,
Hmm.
especially with the centers having these protocols set in place and hopefully being followed the way they're supposed to be followed. I think you'll feel a lot better once you're actually back in it.
Yeah, I think
which
so
is
too.
good.
Just to see what it's going to look like, because before, the unknown is what scares us the most, right? I don't know what it's going to look like. I don't know what it's going to feel like. But it's like, it's funny. I was going through my stuff, like my bathroom stuff, like deodorant, moisturizer, like things like that. And I found this old deodorant, like it's still good, that I wore last summer. And the smell, I like, as soon as I opened it to check if I still had any left, the smell just hit me, and I was inside my preschool. Like,
Oh my
it just,
goodness.
it hit me like a train. It was so wild. Like, I remember, because last year our AC in our room got too cold, and I could feel like the kids' really cold hands going, Matricia, I'm cold.
Oh,
And just thinking about those children too, like children,
yeah.
like, because it's when you're in a childcare center that you go past preschool, you get to see them after, right? Especially because we have the school going on. You okay, buddy?
I just spelled it on myself.
um so that part is nice. And I'm also like, I work at a center that um does things by the book,
Yes.
and worries about our safety, and worries, and we talked a lot about, um like, they asked us about our concerns. And um, most of my center is school age and kindergarten, and we talked about how, like, hey, uh, two staff, 8 kids for grade 2 is great, but two staff, 8 kids for preschoolers, although it's still in ratio, it's not what we are used to, because we
Yeah.
have 4 staff for 16 kids. And what does the disinfecting routine is going to look like? Is one of us going to be disinfecting all the time? So we were able to have those discussions about safety, especially when going outside, and we came up with a solution. So that made me feel confident and safe. So that's pretty great. And I'm
Yeah.
thinking that next week we'll have more content on regarding training and stuff. So that should be interesting too. But I don't know, like, I feel like I get a lot of messages, especially on group messages on WhatsApp, of like, oh, this is what we're gonna do when quarantine is over. This is how we're gonna do when this is over, whatever, whatever. But it's not going to be like one day, like, yay, the virus is completely gone. We can go back to licking each other's faces. Woohoo! That's not how it's gonna happen. But I don't want to be a party pooper, so I don't say anything. I just send a sticker. You know that one of mine that I has like the hair is huge, and I'm going like this.
Uh,
I
It's
think so.
very
You
good.
send so many stickers.
I do. I am a big fan of stickers.
I can tell. I love it.
Yeah,
I don't
Brazilian
know how
people
to
are
send
very big.
stickers. I'm really bad. I don't know how to social media. So I don't
Um,
send stickers.
Brazilians are very, very present on social media. Um, but yeah, it's gonna be a very different summer. No trips with the kids. Water play is gonna be very limited. But it's still gonna be fun because we still
Yeah.
get to be with them.
Yeah, you're gonna have such great stories. And they're
Yeah.
gonna have awesome stories to tell you. Just wait.
Oh yeah.
It's gonna be like a never-ending like vomit of words, which is because you're with preschoolers, right?
Yeah.
So it's so much fun.
I
You
hope
know,
doing our podcast so we can include those stories.
I hope so. I can share a few right now because we do have an app called Flipgrid, which Flipgrid, if you're listening to this, you suck. Um, it's a, it's an app
Guess we
that
won't be advertising them one day.
this podcast is not sponsored by Flipgrid TM.
We don't sponsor anyone. We don't make any money yet. No, I'm kidding.
So I feel like it's a great app for older kids. My kids depend on a parent's iPad or phone to send us anything, right? And you can only send videos. There's no text, there's no pictures. So like if I want to check in on the parents, because that's part of what childcare and early learning is. You become a community. So
Yeah.
I want to know, I don't want to know only about Johnny. I want to know about Johnny's parents, Johnny's Johnny's grandparents, because they come to the center. I've met them. They've come to my chili night. Like I want to know. Just before we closed, we had a chili night in our preschool with like 45 people inside the room.
Ooh, that must have been gassy. No, I'm
No,
kidding.
it wasn't. It was pretty great. But we had like several sets of grandparents, lots of baby siblings. Like it was packed. I think 14 out of 16 families came.
Wow.
Right? So like that's a lot. And
That's really cool.
so I don't know if that became an outbreak. But anyway, so like that's why I don't like that app, because you have to send videos, and the kids, they're not like us. They don't just pick up a phone and do Instagram stories. They're 3.
Yeah.
So a lot of them did. One of them, it was our last child to be using the potty. And when we first started the Flipgrid and we told the families and whatever, his first video, he did a video for each one of the teachers, I think, and then the video to say, "Hi, Patricia." "Hi, Patricia." And his mom's like, "What do you want to tell her?" And he goes, "I put in the toilet." And the first video ever was, "Hi, poop." That's it.
Wow.
It's a 3-second video. It's pretty great. But yeah, so like that was good, because then we got to see a few of the children. But because it's not a very user-friendly app, not all the families went for it. But we'll see. I'm hopeful that we'll figure out what September looks like soon, because right now we're not doing intake for our daycare. So I might not be a preschool teacher in September. I might be with JKs or something.
One older.
Yeah. I don't know if our preschool room will be a preschool room.
We don't even know what it will look like by September, because we still have 2 months.
Yeah. And things are changing day by day, right? And like there's people saying just open up schools like they used to be, or just do half days and half online schooling and half in-person school, like that. I'm not very trusting on this model.
Yeah, it's weird. Like, I think that's the one reason I'm excited to go back to school, is because I kind of get to still be a part of it, and I can still advocate, but like don't have to be the one
Dealing with
it out, if
Yeah,
that makes sense.
for sure.
That's a little selfish of me, but at the same time, it's like mental
Yeah.
peace. Like, I'm here supporting anyone, but like it's kind of nice to not be
thinking about that, for sure.
Yeah.
Because we really don't know. Like, if the school boards and the governments are having talks about what it's going to look like for childcare that are inside schools, because my childcare center is inside a school, I don't know about that. I don't know what's going to happen.
Yeah.
I don't know what kind of talks they're having. I just hope that they remember that we are essential and that our spaces need to still be there. There was someone, I think it was on our meeting on Tuesday, Tegan, someone said that we lost as many as 60,000 spaces in Toronto with the new guidelines.
Wow.
It was something like that.
Toronto.
I think it was when we were talking about the motion to make childcare an essential service that Joe Cressy and I want to say Mike Layton put forward at City Council. So 60,000 is a lot.
That's a lot.
That's a lot of spaces, and we already had a shortage.
Right.
So it's very depressing. And I think I also like a huge part of it, of my fatigue, of my exhaustion, and like why I needed a break from social media, why I needed a break from some meetings, was that like when I look at things long term, I was just saying that I have this issue with worrying about things before things happen.
Yeah.
But when I look I look at things long term. It's like this year with the pandemic and everything that's happening has thrown not only my life and my timeline off completely. It's thrown everybody's, most people's. But it makes me think like,
Uh-oh.
because of what?
You froze for 1 second. It's okay. You're good. Keep going before it
Okay.
happens.
It makes me think of, will I be able to achieve all the things that I want to achieve? Because things have been, you know, shitty,
Yeah.
right?
Like, Tegan, how do you deal with the stress? Like, what are you doing?
I try to spend as much time outside as I can. I bike and I garden, and that helps. But like, how do I say this? I have a lot of like insecurities in other aspects of life. So like food insecurity, financial insecurity, and it's hard to be an international student right now in Canada. I was just in a webinar earlier today where like international students are advocating for their rights because basically the government just consider international student as like disposable moneymaker, which is sad.
Yeah.
But yeah, it just happens that I'm in an intersection that just suffer a lot of like inequity. So like early childhood educator students and then international students.
Immigrants. Yeah.
Just so many fights.
Too many layers for sure.
Yeah.
Also, there's a tiredness, and there's an exhaustion that comes with, and I don't think Stephanie feels this, but Tegan and I definitely do, of living your life in your second language.
Yeah, I can't. I don't know anything about that.
As great as my English is, it is still exhausting, because it's the language is not just the words, it's not just what you say and what you hear, it's the culture. And my culture is very different from Canadian culture. My culture is very different from Chinese culture, from Vietnamese culture, from Irish culture, from whatever.
Mm-hmm.
And because I can't go see my Brazilian friends in person. And we're very much about touch, and we're very much about being loud and a little flamboyant. So it's kind of hard. Like as comfortable as I am in my home, it's not the same when I don't have that outlet. So
is it like you have to push it down in? Like I don't know how it feels. That's why.
It's involuntary. Like I hold back my Brazilianness. It just became like instinct or reflex. You know, sometimes I'll mix the two languages. It'll happen a lot. Instead of saying right, I'll go né, which is the same thing in Portuguese. You know, you can count on me, right? And then I would just go, you can count on me, né? And most of the time people don't catch it because I correct myself. But yeah, that happens to me all the time. I don't know if that happens to you, Tegan, but it happens.
Remember, whenever I count, I have to count in Vietnamese.
Yeah. The kids find it hilarious. Like I count them, and the number 8, because usually I go out with the group of 8. They find the word for 8 in Portuguese, which is oito, very funny, because I always go oito, and then they're all going like, I want to be oito, I want to be oito, which it's very cute. And last year, my kids that graduated to JK in last September, a lot of them knew a bunch of words in Portuguese. because I just started saying them, and they just started repeating them, and it was glorious and beautiful.
But see, like it's hard, but it's also a really beautiful thing
It's
that you guys
awesome.
can
Yeah.
bring, right? Like that connection with some of the children that you get to be around, giving them something else that's meaningful is like incredible. And really cool.
And then I think the other component of this is you're worrying for two countries, because the two countries are going through, I'm not sure how Vietnam is going through the pandemic, but Brazil is being devastated by the pandemic. Over 60,000 dead already. So like that's another thing, right? Like you're saying, there's all these intersections that we have to deal with, especially you right now as an international student, and that's part of it, because you're always worried about your family. You're always hoping that everybody's okay, but especially in this situation. Like my mom called me yesterday, and she was like, oh, like chipper chipper chipper, and then she says, oh, but I have to tell you something, and she got all serious, and my heart just started like, because immediately I'm like, she's dying, my grandma died, like something happened. And she was under suspicion of having COVID-19. My mom's a doctor and she's working, so I was immediately like, that's it, she's gonna die, and I'm not gonna be there for the funeral. What do I do? But she's gotten her test already, and it was negative.
Okay,
so we got all the drama.
Oh my goodness.
But she's still taking the medication because that's what she does.
Mm-hmm.
I don't discuss that. I'm like, you know anatomy better than I do. You do you. But yeah.
Yeah, 100%.
I hate the pandemic. I don't think I've said this out loud yet. I fucking hate it.
I don't know, we just hit a lucky spot, I guess, in our lives where we get to have one of the plagues. I don't mean lucky, I'm being obviously sarcastic. Sometimes okay, yeah.
I'm glad it's not like the is it bubonic in English? Like the plague.
Yeah, the Black Death.
Yeah, with the boils and the rat and no thank you.
Oh, okay, guess what? Okay, I was apparently, like, you know, the Mayan calendar and how we turned it into the Gregorian calendar.
Yeah.
So basically the Gregorian calendar is saying we're in 2020, but the Mayan calendar is saying we're in 2012, and 2012 was supposed to be the Dunes year.
Wasn't that like years ago that they said that was gonna happen?
Yeah, but that was in 2012. But now, because we switched from the Mayan calendar to the Gregorian calendar, it's actually 2012 because 8 days a year has been taken off.
Because they don't align.
Yeah.
Well,
so
it makes sense.
Everyone's like, oh, now I get it, because like nothing happened in 2012 and then everything's happening now, which is, yeah. So I thought that was really interesting. Kind of
but
weird.
It's weird. Like I think of all the things that I felt like, oh my God, I can't do this anymore. I need a break. And that's not just work stuff, like just in my life. Right before we closed, there was a lot going on. And I say closed just as a timeline, because not all the things that were going on were work related. And I just felt like I needed a break. And then it came. And the first few weeks of the pandemic, of the closure, of not working, were really hard for me. Really, really hard. Like depression came and stayed with me and made herself at home. And I dug myself out of that hole one more time. Yeah. But it was, and then I've talked to some of my friends, and I'm like, when we were talking about like, I just want this to be over before the pandemic, did we call for this? Like, did we put that energy out into the world? Like, like that fear.
I think everyone was putting that energy out, because like I do that too, because the whole time I was like, I just need a break with nothing to do.
Yeah.
And then it happened, and I was like, this is not
what I wanted. Yeah.
I wanted like 3 days. Like 3 days of like no grocery shopping. Like I could just like mope around, and then make it 3 months.
And it's also like, So I went to Brazil. I left here on Valentine's Day, and I was back on the 26th. I was in Brazil for 8 full days only,
Oh yeah.
because it takes 2 days to go there, 2 days to come back, blah, blah, blah. And I went because I wanted to surprise my mom. I ended up not surprising her because she started looking at tickets, so I had to tell her. But it was like the first time that I bought my ticket by myself. Like, it was a big deal. And right before I left, my uncle passed away. Very, very suddenly. He got diagnosed with leukemia on like the 22nd of January. He died on the 6th of February. So when I got there, my trip became all about my aunt and my cousins and how I could be there for them. So it was a very different trip, because usually when I go, it's like, yeah, I'm busy all the time, because I go out for breakfast with someone, and then I go out for lunch, and then I hang out with someone in the afternoon, and then I go out for dinner, and then I go out for drinks. And it's like the turnover of everything is a lot. But this time it was like I spent the whole time basically at my aunt's house, and I don't regret it at all. But it's like, it's weird to think that I have no idea when I'm going back, because I like to plan to go in 2022 or 2021, but the reality is I have no idea if that's going to be possible. Not
Yeah.
just because of closures, but because money,
Yeah.
right?
That's
Hoping that my center will stay open and I will still have a job for many years, but I don't know. I keep hearing Cardi B's voice going, coronavirus, anytime I try to plan something.
It's like a weird thing, because it's like you can't put everything on pause, but you have to also be very cautious about what you're choosing
Yeah.
to do. Like, very calculated, and make sure that you're doing it because you need it for yourself, and you need it to do it for other people as well. So
Yeah.
I think it's just taking some time and figuring that stuff out.
And it's the kind of thing with this, we have to live through it to deal with it. It's not something that we can just put it in the back of our minds and not think about it.
Yeah.
Because it's
No.
changed how we do everything. It's changed how we do everything. Like I'm someone, like my subway station is Victoria Park Station. In Victoria Park, the elevator is broken very often, out of service. So there's a lot of, like, when I was getting off the subway, there would be like elderly people carrying groceries or carrying carts, and I would offer to help all the time. And now I'm like, will they be offended that I help? Will they be scared that I'm carrying something? Like, I've been wearing a mask anytime I go on the TTC, even before it became a rule. But people have the right to refuse help,
Yeah.
right? So, like, that kind of throws me off a little bit. And then I think about people that are going through, like, my friend just had a baby 2 nights ago, like the day of the meeting, right? Because, like, she went into labor right before the meeting started. So during the whole meeting, I was like checking my phone to see if the baby had been born.
Oh yeah, congratulations. I didn't
Thank
say it to
you.
you. So excited.
Thank you. He's very cute. And mom and baby are great. They're very healthy.
That's awesome.
And like, this friend of mine, we were born on the same day in the same hospital. And, like, our parents saw it, like, our dads saw each other in the hallway or whatever. And we didn't meet until we were 12. So we always had that kind of, like, that weird connection. And her name is my sister's name. Just
Ooh.
funny. But so it's wild to think of someone who's exactly my age with 2 children. 2 children that came on purpose. But because I'm getting up there, I'm almost 30. But to go through that during a pandemic, to have a baby during a pandemic, to be pregnant during a pandemic, to postpone your wedding because of the pandemic, to move houses, to like, and like those are like happy milestones. What about the sad milestones, right? Like people who are losing loved ones,
Who
people
couldn't?
who are breaking up.
Yeah.
Like when I went to the curbside birthday party that I told you guys about, one of the moms told me that like I think, and that's the thing, I think people are afraid of being judged, so they over explain everything. And she was saying that like, oh, these are friends of ours, they are isolating with us. And then she told me like quietly like, oh, because her and her husband broke up and she was going to be alone with the 5-year-old, so we're like, let's just be in each other's bubbles and support each other. Going
Yeah.
through that in the middle of this, no thank you.
Well, it was like a big, like, honestly, it's a big culture shock because we're so used to being busy on the go, 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 go. And then you have to finally, like, let things
Slow down.
settle. And, like, it's a really hard thing to do. And, like, I even was, like, talking to my mom about it. It's like, it was a weird question to ask, but I was like, I wonder how many people are going to get divorced during this.
Yeah.
Because I was like, people aren't used to being stuck with each other in, like,
Yeah.
a small space constantly. They have something to distract themselves. And like that's why like depression kicked in for a lot of people,
Anxiety,
like wanting to get into a relationship. So people may have started a relationship, people wanting to leave a relationship, people doing like the amount of like pool rentals that happened like is insane during this time because everyone's like, what are we gonna do? So they fill up their time.
my chiropractor was saying that she's had a lot of new clients come in.
Oh wow.
And I'm like, are people just like finally realizing that they have benefits? Or because I wish I had unlimited chiro. I would love to get adjusted every day. I know that that's not recommended, but I would love to because I feel a big relief after. But also because people have time to go, because that's a big part of it. You don't have time to go,
Yeah.
right?
So true.
A lot of people buying bikes. Like the whole saga with my bike that like one tire blew out and then the other tire blew out and the pump was broken and we didn't have it was very dramatic, listeners. I cried a lot because I cry out of frustration all the time. But the guy at the bike shop said that there's no more bikes, like they're all in back order. They're all in back order. And I'm like, a bike shortage? Wow. So I'm
You should
hoping
have
that. Sorry, go on.
Oh no, I was gonna say you should have seen the mall. Like it's finally dying down, but as soon as the mall opened, everyone's like, I need shoes. Like the amount of shoes, I was like, wow, you know what? I agree, you do need shoes. You should buy more shoes. You should come when I'm making commission too, because like, buy more shoes.
Everybody should buy shoes like mine and get this awesome tan on their feet.
Yes. Yes.
Every summer. Every summer, my tiger feet come up. I I hope that I'm able to bike to work every day. If Monday is as hot as it was today, that's not going to happen because I would faint halfway there. How far? Tegan, it's not that far. Google says it's 24 minutes, but in Patricia time, it's not 24 minutes.
There are a lot of uphills. I know, like
once I get past Woodbine and Coxwell and stuff, it's pretty flat, if not downhill. But it's like 9 kilometers.
That's pretty decent.
Yeah.
Oh well, it's saying 9 kilometers if I go through Taylor Creek Park, but here, which is I go through the Danforth, it's 6.7 kilometers, which is not that bad. But if you're out of shape like me, it's a lot. I think we're just over 1 hour.
Ready?
I think so, yeah.
Yeah. Of an episode of basically just chit-chatting.
You know what? Next time we should live stream.
That'd be fun.
Oh, like do like a live. Do you know how to connect Zoom to Facebook Live?
Do you guys want to watch us live?
Yeah, let us know. That would be great.
Post it down below in the
But it's
comments.
also, we can do a live episode of talking about something more specific, because this episode was talking about nothing.
Basically. Well, nothing and a
Nothing
lot.
and everything. Yeah.
Hmm.
It was just us rambling a lot.
Yeah.
And like, hopefully you can ramble along with us.
Yeah, just a little bit of venting. Because we're talking a lot, like educators are now thinking we moved past let's do a safe reopening, because we're seeing that the government is not listening to that. And now we're going through our resources to see what is our safest way to reopen, what is our best way to reopen. So maybe we can talk about that next time. I don't know. Because this episode was a lot about our feelings and our.
Also, if you guys have topic ideas, just like tell us.
Yes, please tell us.
That's cool too. And please send us stories, okay? Oh my goodness. Like,
Oh,
we
I
want to hear
forgot
your funny stories too.
I forgot to post the stories. I'm sorry.
That's okay.
Yeah. Um, should we finish with a story today?
Mhm.
Yeah.
Tegan, do you have one? You haven't done one yet.
Yeah.
Put her on the spot on camera. Let's go, Tegan.
Poor Tegan. Poor Tegan. But it's also, we have more time of childcare than Tegan does.
I know. I'm just joking.
I don't remember the last time I was with a child anymore. Like months. It's so sad.
I miss them so much.
Right?
I actually, I did a Zoom with my kids and we made I miss you cards and then we showed each other I miss you cards. It was so funny.
They're the best. I did a tarot reading yesterday, which was pretty fun. And one of the symbols that she got in the cards for me was what brings, when you're in a dark place, what brings you to light. And the card that came for it was the card of the star. And she was like, well, this can be read as friends who don't let you get deeper into the hole, that are always putting things in perspective. But it's also the star is a symbol for children. And I was like, good, because they are what gets me grounded. Because it's I don't know if you listeners go through this. I think I've talked to Stephanie and Tegan enough to know this, but even though we try to leave our problems outside the door when we go into a childcare room, some problems stay with us, right? Some issues stay with us because we're human and we get distracted. And then all of a sudden, a 3-year-old will say something that just snaps you back into reality. And that thing can be hilarious or it can be super insightful. And that always makes my day. I was thinking about that when I was doing the EC challenge, because that's the biggest thing for me. It's they put things in a perspective that, as a grown woman who's pretty negative,
No.
yeah,
No. You're not negative.
I
a little jaded and cynical, but that's not negative.
No, I see. Because I always prepare myself for the worst. Because if anything that is not the worst comes along, that's a profit. That's a plus, you know? But yeah, children have that power. So I thought it was pretty cool that came out of it. It was a very interesting experience. I have a childcare story that is not a childcare story because the child was not in my care. Do you guys want to hear it?
Sure.
So
child stories.
Before I worked at my current workplace, I worked for a big childcare provider. And right outside the center, there was a Starbucks, and it had a little patio with plants and whatever. And this place that I work for, they also run a summer camp. And then in summer camps that are not run by early child educators, they're run by teenagers. So the people at the camp decided that they were going to take the kids for a picnic at the patio at Starbucks. And I was just having my lunch. I had purple hair back then too. It was funny because I just got on my memories on Time Hop, a selfie that I took that day. And they were having lunch. I was having my lunch, and I'm just hearing the conversation among the children and being like, I know what's going to happen. So they had moved a rock, and they found worms. And the counselors are not paying attention. And I'm just here sipping on my mocha. I'm not going to get involved. I'm not that person. And this boy goes, I'm going to eat the worm. He was probably like around 7 or 8. And the other kids are like, yeah, eat the worm, eat the worm. And it was a big worm. It was like thick and slimy and disgusting. And by the time, like, I think one of the kids told the counselor, but by the time the counselor looked, the worm was already like in his mouth. Like he just went, and the counselor was just like, this counselor was a kid. Like he couldn't be older than 16. And he was just like, that is so gross, dude. That's so gross. No, don't do that. I'm going to get you water. You have to wash out your mouth. Because the kid was going like this to show that there was no worm there left. Pure protein.
That's how to eat fried worms was created.
And no, this was a fresh, alive.
Oh.
Yeah, moving. It got killed by, I don't think he bit it. I think it got killed by the stomach acids. So I was just like, interesting. Children are lovely.
Thank you for that one. We'll have nightmares soon.
It would be really funny because this is a few years ago, if that child was on YouTube and he found this story and he's like, hey, that was me. I pooped out that worm later that day. Stop saying this about me. Like, that would be hilarious. But that's not going to happen. Anyways. Yeah, I think that this was good. This was cathartic and therapeutic. Listeners, thank you for listening. We will be back soon with directed content, outlined content.
Yes.
But always high quality content. That's what we always provide for you. You know, whether we're showing you our faces or not. Also, tell us if you like this, because if you like this, we could do the YouTube to look like this all the time.
Or more often.
I know you love seeing my pile of laundry, my camera tripod, my moisturizer, right?
Your fan.
Yeah. Stephanie has a fan too. We're matching.
Me too.
A kitty tower. My Lego building's up there. I'm trying to hide it because I'm trying to look professional. I don't want to look like a little kid.
Your Lego building?
Yeah, it's called Stephanie's house.
Hey girl, I spent the whole day playing The Sims yesterday, so
oh my god,
highly recommend. Very cathartic. You put the name of your high school bully on a person, and you make them super mean, and then you make them get arrested. It's great. It's great. But yeah, so give us suggestions. We have a whole list of topics that we want to cover. And they're all very important, but we just felt like to be authentic and to be genuine with what we're feeling and what we feel other educators are feeling, we had to do this.
Yeah.
A little more informal. And yeah. Do we need to say the Childcare Revolution Podcast is not affiliated?
I will just add that in at the end.
Okay. You're getting so much backstage info.
Yes.
Thank you for listening. We will talk to you soon.
Thanks,
Bye.
everybody. Mwah.
The Childcare Revolution Podcast is not affiliated with any universities, colleges, associations, or institutions. Just a couple of passionate educators speaking some thoughts into the air. Thank you for joining us. Please like, follow, and subscribe to listen to more episodes of the Childcare Revolution. Send your childcare stories, questions, and comments to our email. And it's childcarerevolutionpod@gmail.com.